physiotherapist from Precision Physiotherapy and Hamilton Physio and Rehab. Today we're going to talk about lower back pain, but a different type of a lower back pain where you're experiencing tightness, stiffness, and some sort of an ache just on one side of your lower back and not all over. And this is when you are, if you're right side dominant and you're doing a lot of strenuous activity, rotating and turning onto one side, construction work, squatting, doing dishes, lifting, moving, end of the month moving from one place to another and lifting a lot of heavy boxes, and then you end up being a little sore and achy and stiff on that one side of the lower back. Of course, the traditional way and method is more often than not you'd always be looking out for some sort of a stretches, some sort of a pose so that you can ease the tension around that area. But then you feel better, you feel good, but you go back and do that same sort of a movement, next morning you're sore again and stiff. So you're in this vicious cycle. How do you break that down? So you want to try and, or at least me personally, I like to have a lot non-traditional approach. Stretching is good for that time being, but we want to try and solve the root cause of the problem or actually solve it for a longer period of a time. That means you want to try and load those tissues, because if you're squatting, bending, moving, rotating and doing those movements repetitively in one direction over a period of time, then what do we want with our rehab and treatment solution? You want to simulate these movements in the exact same manner where you're loading these tissues. So a couple of my simple things is a kettlebell or a dumbbell or a briefcase, whatever you want, or even a laundry detergent that you could use at home. And if at all this is the side which is tight, that's the side I'd want to actually load. So now lift this up, have a carry on over to one side, and once I've done that, the opposite side, I'd want to do some side bends. And this is about a few repetitions, 5 repetitions like that, and then 5 sets. And then you're activating the other side, which is kind of inhibited, and this side is getting all the attention, so you're refocusing that attention, and that's going to really help. The second one would be to have that carry and then let them go away from this side. The moment you do that, you're again activating the opposite side, which is taking the tension and the tightness away from the side which is painful. The third one would be the side bends. You must have seen me doing this in some of the other videos. The idea is that if this is the side which is painful, then that's the side that faces towards the wall, with my elbow like this, feet together, and then a little bit of an arch on your lower back if you can tolerate that. And the idea is to go as further as you can, load that tissue, and then come back. Load that tissue and come back. And this side, if you can, this particular one, you can alternate and do it on the other side as well, and that should also help. Give these a try and try and have your pain relief to sustain a lot longer, so that you can get back to moving and doing things that you have to do. There's no compromise to that. It's not about when you're in this pain, you stop doing it. You have to find ways of how can you do it pain-free and still continue with your life. Until next time.